get to a hospital to care for what they're dealing with. So we really have it good here because some of the hospitals that we have made the list of being some of the best. So those are all things that we look at, but also let's look at neighborhood housing. Some people are living in the street because they don't have a place to live. Other people are living in houses that if an inspector went in, they wouldn't be able to stay. So we got to look at housing. And then you have social and cultural community contacts and food and transportation access. So with food and transportation, I always like to remind people that we give away food all of the time. And other people give away coats, and it's all kinds of things that people give away. But in talking to some of the people who are the recipients, they say things like, they advertised all week that they were giving away coats, and I got on the bus, and I took 2 buses and went all the way over there and found out that they changed it to next week. We can't do that. You have people who, they want to get the food, but they can't bring their 4 children over here with them when they don't have a car to get the food and then get back. And then even when we have like heavy stuff, our seniors can't lift the heavy stuff. So it's a lot of things that you have to think about besides we giving away, we doing. You gotta think it all the way through because otherwise you trying to do a good thing, but maybe it's not quite as good as it could be. So I'm gonna be doing this community health work because the only way I can be a worker is to do the work. All right, so what is a community health worker? Well, if you look at this picture here, you'll see a bridge. And you got people on each side, and they bridging this gap. So community health workers look like the people in the communities they serve. If I don't understand what it's like to be poor, then when I come in, you're not gonna wanna deal with me because we kind of going through now where wealthy people are making decisions for poorer people, and they're not always compassionate. They're not always gonna work out in a way that's gonna be favorable for those people. So you kind of gotta have an understanding of what it's like. You know, I've never been hungry or homeless, but I've had friends who were hungry and homeless. I've had friends that didn't have lights on. That was never the case for me, but that's been the case for some people. So we know that community health workers, they advocate and they work to address the need for better healthcare access and improve health outcomes. And I put in all of the time, and I can't say I enjoyed every minute of it, because sometimes I got stressed out. But that's normal. You know, that's normal to get stressed out, because when something starts to get a little bit, you know, we want to just quit. I am a lifelong learner. That's what I do. As I finish one thing, and then I start learning something else. I think it's kind of healthy for me, because otherwise I'd be getting myself in trouble. So survey question 1 was about physical health services. Have you heard of community health workers? And almost 6 out of 10 people said no. And then you had a third that said they've heard of them. And you had a handful of people, 7.5% said no, other. So I'm not quite sure what other is, but okay. Question number 2, are they available in your area? Again, we had almost 7 out of 10 who said, I'm not sure. You had 18.5 that said no, and another almost 15 that said yes, they know that they're in our area. So question 3 was, what type of assistance do you think they provide? So we gave some choices, and the top 3 were health education, health goal setting, and program enrollment. And that is actually right. Social support and information counseling, and navigating the healthcare system. How many times have you gone to the doctor and they tell you that they want you to get MRI and an X-ray, but get the X-ray first, and I need you to get some blood work, and I need you to, and then you go and try to call and set up those things, and you get frustrated because it's just not working out. It becomes overwhelming. And so a lot of times what people do, they just say, I'm not going. It's just too much, I'm not going. Well, that's not really the right thing to do. You need to reach out and get somebody to help you. I don't care how old you are. If you need help, ask for the help. Sometimes we want to be so independent that we don't want to say, I need somebody to help me make these appointments. Or can you call and check on? Just do that, because it is better for you to have and use the help that's available to you than to become frustrated and just give up. And question 4 was, do you regularly see your primary care physician? So that's pretty good. We had about 7 out of 10 saying yes, and I followed their advice. And then we had about 21% who said, I do go, but I don't always follow their advice. And that's good, because that was real honest. Then you have, no, I don't even go. So they're likely the people who just go to the emergency room. And now they're making it so they don't want you going to the emergency room. They want you to go to these prompt cares and these places, urgent care, and go to those places to keep the ER not so crowded. And actually, I mean, it kind of makes sense, but if you go see your primary care physician, they try to make sure step by step that you're well, that you're getting the test you need, as opposed to on the back end after you get sick, going in there and trying to figure it all out. So we're coming down on the end of these survey questions, because I'm ready to be done with the numbers. All right, so 90%, do you take your medication as prescribed? 90% said, yeah, I do, and I manage my own treatment plan. But you had 7% who said, I don't even take any medication. That's great. I'm assuming they feel real good. And then you had 3% who said, well, I sometimes do, not always. And then you had number 6, are there health services missing or hard to find? And people were able to give whatever answer they wanted. So you had affordable health care was an issue, seeing a specialist was an issue, transportation was a big issue. I really think transportation is a big issue, because sometimes you go to the doctor who's local and they tell you they want you to see the specialist in Reisterstown, Maryland. Okay, I've had that experience. I had to go, I had a pink eye, and it was a severe case. I could hardly see, but I had to drive to Reisterstown, Maryland to see the specialist that they sent me to. And then after he examined me, he said, come back tomorrow, because your case is so severe, we need to see you again tomorrow. And I'm thinking, out of all the people in the world, he should understand that this driving all the way out here is a problem, but I managed, and I'm glad I did. And then question 6 was, are there health services? Oh, we did this one, right? Companion. So that's another thing. Sometimes we go to the doctors and we just need somebody to take us there. and bring us back. And many people say, well, you could just get mobility. But mobility comes with some challenges too because of the scheduling. The scheduling is so crazy that it makes it very hard. Okay, so we're gonna be going to what grandmothers looked like way back then and what they look like now. Anybody had a grandmother that sat in the rocking chair? Well, see, here's what grandmothers look like now, in the middle. And then here you got the great grandma. She look familiar? Yeah. Yeah. So, it's been a change in how grandmothers look because grandmothers now are a lot younger than what grandmothers used to be a long time ago. Okay, now health and wellness. What's the difference? Anybody got, has anybody even been thinking about the word wellness? Because that's kind of a new word for me. We always have heard about health, but health and wellness are different. They're different. Health refers to the state of your body, mind, and social well-being right at this very moment. That's your health. And that's according to the World Health Organization, or you may hear it referred to as WHO. And then wellness, on the other hand, refers to the actions you take and the choices you make to lead a healthy and fulfilling life. So the health is what you're working with, and wellness is the steps you take to get your body, your mind, and everything right. So now, have you ever been to the doctor and they told you that, it was something wrong with you, your test results came back showing something, and they start talking, and you look at them just like this little boy right here, because they either using terminology that we are not familiar with, or they talking too fast, or English is their second language. It's any number of reasons why you don't know what they're saying. And some of us do this. And then when you go home, your children will say, did you go to the doctor's today, Mom? Yeah, I went. What did he say? I don't know. He said I need to take some tests. What tests? I got the paper in there. That's what we say. I got the paper in there because we just don't even know. But I'm going to tell you this. When I go to the doctors, it's two things I do. I use my phone. I know a lot of seniors still think of a phone as a device to talk and listen. I'm telling you, that phone got a lot of value. And you need me to show you how to work it, I will. But use that note section and put in that note section, as you think of it, all the things you want to mention. I want to remember to ask the doctor about the mark on my back. I want to remember to ask the doctor about why I cough every night. Things that when you get there, you're likely going to forget. But if you have it in your notes, you'll be able to tell them. And if you don't think you type fast enough, take a piece of paper and a pen, and when they start babbling and you don't know what they're saying, bring them to a halt and say, wait a minute, now what is that? And get through that visit. Now, they're going to be rushing you because they got to get the next patient in because time is money. But they're going to have to spend a little extra time because they're going to have to talk a little slower, and I got to leave there understanding what you just said. So you just make sure that you go in there, and don't overdo it. They got some patients that go in there, am in my line. They got some patients that go in there, and what do? They want to talk about their family history. They want to talk about every ache and pain they ever had, and they just want to go on and on and on. And because they want to be real nice and they don't want to put the people out, they try to deal with it. But honestly, if I was the doctor, I would set you up for the 30-minute visit, and then we can chat, okay? We can chat, because that ain't even the doctor's visit at that point, okay? But I'm going to 7 and 8, and then we out of this. Mental health services. So as Amaris told you a little bit ago, I work at a company called Holistic Health Counseling and Coaching. Now, Holistic Health is the site that I work at, but the program is an AmeriCorps program, and Baltimore Corps runs it. Baltimore Corps sets up all the training, and they do all the tracking of the time and all of that good stuff. But where I actually do my service is Holistic Health. They have 2 locations, one right up the street on 25th in Maryland, and the other one is over on Falls and 36th. They have other places too where they have a gym down the street, and they have a lot of stuff going on. But I typically work Maryland Avenue because the location over at Falls Road is really Saturdays when it's a lot happening, and that's where we are on that day. But have you ever felt a need to speak to a therapist or counselor? And are you open to their services if needed? And we had 37% said yes, and I am open. 18.5 said no, I never felt the need, and I'm not going. That's just, oh, we're not doing that. 18.5 said no, I never felt the need, but I would go if I thought that would help me. And then you have 18.5 said, I'm just not sure. And then you had a 7.5 said, well, maybe. And then question 8 was, what are the barriers that might prevent you from seeking mental health? And some people say, well, there's no barriers. I get there, it's no problem. I could go if I wanted to. And then you had some said, I don't even know where to start. I wouldn't even know how to find a mental health place. And then you have affordability, and you have, I'm not comfortable talking about my mental health. So that one I want to talk about a little bit, because if I throw out the word Crownsville, what comes to mind? What was it? Mental people. Anybody else know Crownsville from back in the day? Say it again. You did? Okay, I got to talk to you. Norma, what were you going to say? Yeah, I do want to know, because it's making my point. Exactly. So what we just heard was cuckoo, the mental institution, nut house, asylum, all these negative terms, because that's what it was. People were going to a facility that was, 1 second, excuse me. People were, just very negative because of the place. Well, I asked a young man the same question last week, and his response was, it's a town. It's a town. And I said, yeah, now it is a nice town. They got some beautiful homes and all of that, but years ago, that's not how it was. Mental health was really, it just was a stigma. You didn't even want people to know you had a family member that was there, and we had several of those. I saw that it was out, but I haven't read it. Black people own the property? Oh, see, we got some Anne Arundel County people in the house. Like you what? No, I'm trying to give you credit. Here you go with that stuff. We ain't having it. We ain't having it. So I'm going to have to get that book. Yes, ma'am. Shepherd Pratt is up here, but Shepherd Pratt kind of changed with the times as opposed to Crownsville that just shut down. So Shepherd Pratt is still in business, but they do things a different way. So now at our age, not every day will be a good day. Accept it and make conscious decisions on how to feel better. That's what you have to do. It's okay not to be okay, but you have to recognize what's going on with you, because sometimes grief is one of the things that can mess you up. You lose somebody and it seems like you just can't get right. Every day is just hard and you just deal. But you know that if you talk to somebody and they've been trained to pull out of you the information that they can show will help you, you'll feel better. You'll get through it easier. It's a lot of times that we heal on our own, but sometimes we need professional help. And it's okay for you to get some services. There's no longer the stigma that it carried years ago. So now I know you get nervous because we still thinking about Crownsville, but let's forget about that and let's think about overcoming the nervousness. So what you want to do is really minimize the stigma. We don't, all those words that we came up with, you don't hear them anymore. They are no longer acceptable terms. When you're talking and you want to be politically correct, you can talk about mental health, mental illness, but we're not calling people crazy. We're not calling them nutty and any of those things that were acceptable terms years ago. So we know that mental health services have evolved significantly compared to the past. And currently, you have options that include individual therapy, family therapy, group therapy. You have the conventional office environment where you can go sit on the couch and put your feet up and lay back and say what you got to say. Or you don't even have to leave your house. You could do a virtual consultation where you at your house, you could do it on your phone. You can see your therapist and your therapist can see you and you talk. And even if you're not a person that does FaceTime and all, you can just do it with the audio. But you don't even have to leave your house. If you need that help, just reach out and get it. Okay, so some signs to watch for, because sometimes we don't even know how bad off we are. If you experience any of these signs that I'm getting ready to tell you about for more than 2 weeks, it's time for you to reach out for some support. So you need to contact your doctor, and your symptoms could be physical or they could be mental. So if you're feeling sad, hopeless, and just not feeling yourself and you don't know why, you might want to call that doctor. Withdrawn, with social isolation, loss of interest in things you once enjoyed, feeling anxious, worried, or irritable. You don't even know you're irritable, but everybody's telling you how irritable you are, but you think it's everybody but you. And then you have unexplained aches, pains, or fatigue. You can't sleep or you're sleeping too much. All of those are signs that you should watch for, because it could be something that you need to work through, and there really are people who can help you get through that. So I told you a little bit about holistic health, and their services are individual counseling. They do medication management, substance abuse, psychiatric rehabilitation program. You may have heard of PRP. And they have a gym down here off of Green Mountain Biddle where they have a men's wellness group. And then for the young people, they have a different kind of wellness. They got like a football team, and they do a lot of physical activities to get these kids moving. They can't do push-ups, they can't run, they just sit in front of a computer and they talk to people that may or may not even be real. But we need to make sure that even if we feel like still have that thinking that we shouldn't be going, rethink that. So now you know more about CHWs, you know more about what community health work is, you know the importance of adhering to medical advice, you know how to recognize your feelings, both physical and emotional, and you know the difference between health and wellness. So no longer do you know, sit there and just feel bad and not do something about it. We're doing a mindset change, and we got to get all the way changing our minds so that we are accepting the way things are now and doing the things we need to do. So my question to you is, did you hear anything today that might change the way you view your own health and wellness? So nobody heard anything. I'm going back to slide 1. So did anybody hear anything? This is your last chance not to go back to slide 1. I heard something. Okay, let's hear it. Right. Yep. Right. All right, Teresa, I saw your hand. Mm. Okay. Joanne and then Cynthia. Cynthia? Right. Right. Wait, don't tell me your name. Allison. Right. Ah. Yes, ma'am.
that you, I don't know if people are aware, when you go to your physician and they are giving you all of this information, you have a right to an advocate. And a lot of places aren't necessarily asking you, do you think you need an advocate? It may not come in the sitting there moment, it may come in the understanding of the information. And you can also demand and expect a physical copy of everything that they're telling you, that is your right. To walk out with the paper so that maybe you can have someone that you trust and that you know how to advocate for you. It's one thing to call the doctor when you're not feeling well. It's something different to call the doctor after you've had a visit to understand. And it is also a gap for our community, our elder, our senior community.
And all of the hospitals have community health workers now. And they are hiring and hiring and hiring because they realize they don't have enough. And the thing with, anybody here use the portal? The My Chart, they call them different things, but it's the portal. I highly recommend you do that because you may say, well, I'm not a computer person, I don't know how. You know, all you gotta do is call your grandkids and they gonna go in there and tap, tap, tap and put it on there. And even if you can't get in there for yourself, they can or your children can, and the information that you forgot or didn't understand, somebody else can look at that right there, and it's everything. It's not pieces, it's everything. So I encourage you to sign up on that portal and I don't use the computer as the excuse. Yes, ma'am. And that's good because you want to make sure that you're not taking this medicine that don't work with that medicine and making yourself even sicker. Yes, ma'am. Okay, we're gonna take two more, because it's time for y'all to eat. Okay.
Say that, I don't know if, and I'm sure everybody probably does know, but everything that happens to you as a doctor, this is on a computer. Every doctor knows everybody, they know what's going on with you. Everything that any doctor does to you is on that computer, and all they gotta do is hit a key, they'll tell you everything and anything that is wrong with you. So,
Right.
I was just gonna recommend, many of us has the magazine, the AARP.
That's a good magazine, AARP.
Good magazine because recently, I don't remember whether it's this month or last month, but anyway, it talked about, how the number of patients, the doctors have so many patients that they can't keep up with everything. And I read it quite often because there's a lot of information in there that you can glean from when you go to the doctors and stuff. So the AARP newsletter, it's not a newsletter, but it's a
Yeah, and it's very good. So I'm gonna end it here for now. We still have the afternoon to pick this up. Anything you didn't get to throw out already, try to remember. You might want to put it in your notes. And then we're gonna go downstairs and we'll have lunch. And then right after lunch, I'm gonna be turning it over to our health workers. And they're gonna talk to us a little bit and they're gonna do these assessments. And then we're gonna get into some other stuff and win some prizes. Okay, so I thank you very much. Thank you for your attention and your participation. And we'll move on to the next bit downstairs. Okay, that's where you clap, 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 clap.